So this is Margie McQuillan, and she is part of our career path speakers. And one of the paths is to be a medical assistant for your career. And so, oh, there she is.
Come on in.
One more. Hi, Abby. Hi.
Hello.
Okay, just in time. So we're just starting. We're just making an introduction. I'll just have you. Where are you going to sit?
I don't know, I'm going to come around, so
All right.
on the other side of the pole.
So this is Abby. She's one of our freshmen.
Hi.
And so,
Wow.
you're a freshman. All right.
Okay.
So Margie, take it away.
So, hello again, everybody. I'm Margie. And I think how lucky you are to be sitting where you're sitting. To be a medical assistant. I've been a medical assistant for 45 years. Love it. Absolutely loved my career. I'll tell you a little bit about how I started. I graduated from this lovely college in 1974. And from my extern, I got a job, which probably a lot of you will too, from your extern. And when I started out with 3 doctors, Dr. Beachman, Stein, and Hoffman. And, when you first start out, you don't know everything. And you're not supposed to know everything. And it's a learning experience for you. And so you're like a little sponge. You're going to soak it up. So when I say that, I say soak up the positive and squeeze out the negative. Because in every field, there's always some negativity. And especially when a bunch of women get together, a lot of times, it's chat, this. And don't get involved in it. Don't get involved in it. Go in and do the job the best you can and to the best of your ability and leave all that there. I always used to say to the girls, I worked in a doctor's office for probably maybe 6 or 7 years before anybody knew I even had children. Because I don't bring my personal life into my professional life, and I would advise you all of the same. And it's only because as much as people say they don't want to judge you, they judge you. Whether you believe it or not, they will judge you. So if you go in, like there was a girl that I worked with, and she would come in the morning and she'd say, "Oh my God, my boyfriend beat me up last night and he shot up my car." Oh, and you're here working, so that's a plus. But could she work well? No. She had been beaten up, her car was all shot up, and she had this boyfriend, she had kids, and she was a mess. So then so she's telling this, and my boss is sitting right there. So now my boss is thinking, I got to keep an eye on her. Because obviously she's having trouble at home, and obviously she's not going to be able to do the job correctly. She's a nervous wreck. So, not to say that, granted, if someone's hurting you, you should tell someone, but don't bring your personal life into the office. Leave it at the door. Don't tell them all about your kids. I know that it's important to talk about your family, but not when you first start a job. It's just like, you got to be careful. And you got to be careful of the person that comes up to you when you first start the job and starts telling you about everybody. They're the one you got to watch out for, because they're the ones who are going to be telling everybody about you too. So just be careful of that. That's a big scenario in medical offices. And I've seen it because I was only in 3 medical offices, but all of them were the same. It's a bunch of girls together, women, and if they think you're better than they are, they're going to try to find a flaw. So you stay away from that. Just stay away from it. Just focus on your career as a medical assistant and be awesome at what you do. And forget all that. If you hear them talking, what I would do is, like, if I went into the lunchroom and there were tables like this and everybody was sitting around and someone would come over and say, "Hey, Margie, hear about so-and-so?" And I'd say, "You know what? I don't do that. I don't talk about people. So, what'd you watch on TV last night?" Or, something like that. I don't want to get involved in that. So when the people start doing that, it's best to just say, "Oh, I don't do that. Sorry, I don't do that." And it's better for you. It's better for you in the long run. So I started my career, worked for 3 doctors, and then the 3 doctors split up. And I had the opportunity was chosen by all 3 to go with whoever I wanted to go with. One of the doctors was a cardiologist. EKGs are okay, but that wasn't my thing. The other one was a pulmonologist. People spitting in cups, not so hot. The other one was hematology oncology. Oh yeah, that was what I wanted. So I was a phlebotomist. I didn't learn phlebotomy here when I was at STCC. The doctor showed me how to become a phlebotomist. See one, do one? Are you kidding me? I was like, oh my goodness. So thank goodness the gentleman that he had me work on had pipeline veins. So, but this was me. Say this is the needle. I was like this, shaking, trying to get in there. But I did it. And as I went on, as you progress, you learn more and more as you go. And if you find someone who will teach you and be honest about it and decent about it, you'll never forget them. This girl I remember from 45 years ago, her name was Janine. She brought me under her wing. She taught me everything. I'll never forget her. She was wonderful to me. And so she taught me all the different ropes, and I decided to go with a hematologist oncologist. And back then, we did our own labs. So I would draw the blood, and then I would do the white counts, I would do the sed rates, I would do the hematocrits, I would do everything right there in the office. I would make my own slides. I'd put them in the right stain. I'd look under the microscope, and I'd count all the cells. So I was doing my own thing. It's not like that now. So, but it was back then, and it was awesome. I loved looking under the microscope. I worked one-on-one with a doctor. I worked with him for 10 years. And I got married and had kids, so I took a few years off. And then I saw an ad in the paper for the same doctor. So I sent him a note, and I just said, I don't know if you'll remember me, but I used to work for you, and I would love it. I see that you have an ad in the paper for a part-time medical assistant, and I would love it if I could, be considered for the job. He still had my phone number, and he called me up. I want you, he said. So I was thrilled with that. And I worked part-time while my kids were little, and I job shared with another girl, and we just hit it off perfectly, and it was a great experience. He was getting ready to retire, and I was like, okay, now what am I going to do? My kids are getting bigger. I could probably work full-time. So I started looking for work, and I had the opportunity to work for Kaiser Permanente. Well, it was phenomenal for me because it was a totally different experience. There were many doctors in one building. There were many people walking around. And all the doctors wanted you to call them by their first name. And I was like, are you kidding me? I worked for Dr. Stein for 10 years and called him Dr. Stein. Never called him by his first name. And so when I got there, they put me with this Dr. Acquista. And he kept saying, you have to call me Vic. I'm like, I can't call you Vic. You're a doctor. Back then, doctors were like gods. Not so much now, but back then. And so it took me a while, but I eventually started calling him Vic, and we had a great practice. Kaiser Permanente went out of business.
Was he adult medicine?
He was adult medicine. I've only worked in adult medicine, but Kaiser Permanente let me work in pediatrics. They let me work in mental health. They had a whole different area. They let me work in GI. So if my manager thought that you had an interest in something, she would allow you to go there and do it. So that was kind of a great manager. She also let me do phlebotomy and work in their lab, which I loved. Loved doing the phlebotomy. But as a medical assistant, you didn't do the phlebotomy because they had a lab there. So I didn't have to do the phlebotomy. And then I left there, and that's where I met Dr. O'Neill. And Dr. O'Neill, when Kaiser closed up, had called and asked me to come to work with him. And he was at Enfield Medical Associates. And I stayed there for 18 years. So I've had a great career with great doctors, but I just want you to know that all doctors are not nice. You probably know that if you've been anywhere. Anywhere you go, there are very nice doctors, but they're not all nice. Like you go to see your doctor and your doctor's really nice to you, and but yeah, he doesn't have to be nice to everybody all the time. Some of them are wonderful. Dr. O'Neill was absolutely wonderful to me. But there were other doctors in the practice that would throw things, that would act like children, that would have temper tantrums, smash the wall, and you'd be like, what? How old are you? Or when are you going to grow up, And so it's just to know that they're not all going to be nice to you, and it's okay. Like a lot of times, like They didn't to me for some reason, and I don't know if it's because I didn't accept it. None of them were nasty to me. Even the ones that were nasty to mostly everybody were not nasty to me for some reason, and I think it was because I wouldn't accept it. One doctor one day did come over, though, and he was upset about something, and he had like a chart in his hand, say this is a chart. And back then they had charts, now they don't. And he put the chart down, and I had a desk like this, but I had a little area over here. He slammed the chart down on my desk, and his pen went flying and hit me in the face. So I just turned around and I said, well, that's unacceptable behavior. And he didn't say anything. So I said that's unacceptable behavior, and I'm expecting you to apologize to me. And he turned around and walked away, and he went down to his office. I went right down with him. I closed the door, and I said, don't you ever do that to me again. I said, you threw a chart down and your pen hit me in the face. And I don't know what's going on with you, but I want an apology. And if you're not able to give me the apology right now, I'll take it whenever you're ready, but I'm expecting an apology. And I just turned around and I walked away. Now my supervisor saw me do this, went down, she was listening at the door. And when I came out, she goes, are you okay? And I said, yeah. I said, but I'm mad. And it takes a lot to get me mad. I'm not that type of person that gets mad easy. So about a half an hour later, came out of the office, came up, and he said, I'm sorry, Marge. Okay, that was it, the end of it. But I have seen some doctors that are just appalling to their staff. And I don't want you to accept that. I don't want you to accept that. And I think that even if you don't say anything, you don't let them know that it bothers you or that it's okay.
That was the best way to approach that
It's
situation.
not okay. Well, I guess if the doctor did something, I might just say, oh, that's unacceptable. You know, and if you don't feel as though you can go to them at the end of the day or whenever and say, you know, what you did today was very unacceptable, and I really hope that never happens again, and just turn around and walk away. You don't have to ask for it. If you don't know them well enough, like I knew this guy. You know, I knew this doctor. I knew him. He knew me. He knew my morals, my values, my way of handling things. And so I felt comfortable going down and saying, I'm expecting an apology. But if you're not, it's okay. Like I worked at Bay State in a BAPO practice, and there was this doctor there, and he was weird. He was just really strange. And when Kaiser quit, they put me in a room like this with a table and a bunch of charts and a telephone, and I was calling in at the time prescriptions for people. So I'd call the pharmacy. Now, I had been doing this for a long time. I knew a lot of the pharmacists. So I'd call up and say, hi, it's Margie, you know, from Dr. So-and-so's office calling in a prescription. Oh, okay, and then rattle off all the information. And so I was doing this, and this guy came in, and now I'm new here. I don't know anybody. He takes his arm, and he goes like this with all the charts and throws them on the table. So I look at him, and I said, what are you doing? And he goes, this is a lunchroom. And I said, those are charts. I said, I'm doing a job here. And he goes, too bad. And he walked away. Now, I don't even know who this guy is. So I get up, I start picking up the charts, I start putting them back on the desk, and I go down to the manager, and I say, this guy just came in, threw all the charts on the floor, and said this is a lunchroom. Is this where I'm supposed to be? Because this is where you put me, and I don't want this to happen again. She goes, who was it? Oh, I'm new here. I don't know who this is. So and later on in the afternoon, this guy comes up, and he has 2 cans of Coke on his head. And he goes, nah, I'm sorry, like a little kid. And I'm like, who is this guy? It's the guy who threw the charts on the floor. Who is this guy? So I say to the manager, who is this guy? And she goes, oh, that's the doctor. Are you kidding me? So then I thought, okay, well, this isn't going to work for me. I'm going to give myself a month here, but I'm really out the door because this is not for me. So I said, all right. So I made a time frame for myself, and I start, get my resume out there. I made a time frame for myself, and they made me work for this doctor. Okay, well, I'm good with it. I'm a medical assistant. I know how to be a medical assistant. I might not know your ways, doctor, but I know how to be a medical assistant. So I'm going to be the best medical assistant I can be. So I start bringing in the patients, and I start taking my vitals, and I'm documenting everything in the record, and why are you here today, and yada, yada, yada. And out I come of the room, and he's standing there, and he goes, does he smell? I said, excuse me? Does he smell today? And here's the patient. I got the door closed. I'm right here. So I said to him, well, that's unacceptable behavior. And I just turned around and I walked away. And I thought, this guy is an idiot. Why is he doing this, So I go to the manager and I said, there's something wrong here. There's definitely something wrong with this doctor. I don't know if it's me, that he's trying to get a rise out of me, or if he's trying to make me do something. But I said, he just did this to a patient. And I said, I find that so unacceptable. She goes, yeah, that's him. That's him. And brushes it off. Like, oh, please don't let me work with this guy again. So I don't know what he was. So the following day, the girls there tell me that I have to go down and clean this office. So I go down and I start cleaning the office. I'm new. When you're new, you don't know. So I go down and start cleaning this, and this lady comes in. She starts screaming, get out, get out, get out. Okay, who's this? So I leave the room, and they're all laughing. All the girls are laughing. They think it's funny. And I'm like, who was that? Oh, that was the doctor. Why is she screaming? She doesn't like anybody touching her stuff. Why'd you make me go in there? Just because. So just be careful of those kinds of things. Those are the kind of things that were unacceptable to me, so I knew I was out of there. So anyway, that's when Dr. O'Neill called and asked me to come to Enfield Medical Associates, and I went, and I was there for 18 years. And I have very good reputation with a lot of people because I've been doing it for so long. So when you call, like, to make an appointment at Bay State, and you talk to the girls at Bay State, and you get to know them, they'll help you. So keep that in mind. If you do that in your jobs, like I would have to call and book a test. And I would say, oh, hi, it's Margie at Dr. O'Neill's office. I'd like to book a CAT scan. Oh, hi, Marge. How are you? Oh, good, good. How are you doing? Good. And then they'd say, well, I don't really have too much. I'm asking for a favor. Anything for you, they'd say. Yay! It's like one of those things like, be kind. Be kind, be kind, be kind. Because these people will help you if you need help. I did get a gentleman a pro bono MRI, which was only because Dr. O'Neill and I have such a great reputation. But you do what you can for your patients. And you remember that that somebody loves them. Whether you do or not, somebody loves them. Somebody cares about them. And you treat them like they're one of yours. No matter how they smell, no matter how they look, no matter how they treat you, because a lot of patients aren't nice. A lot of patients aren't nice. And they'll come in and they'll say, you kept me waiting. And you say, oh, I'm sorry. Well, come on in. How's your day going today? And then you just start talking to them. And you try to calm them down. We had a lot of disgruntled people at our front window. And then they call me out because I'm the one who doesn't talk. I'll just listen. So if somebody comes to you and they're like, they're upset, you say nothing. Absolutely nothing to them. You just listen. And you think to yourself, what if that was me in that chair? What if that was me and I thought somebody did something to me or to my mom or to my sister or to somebody? What if that was me in that chair? Would I want somebody yelling back at me? No, I don't. No, thank you. So you just listen, and then you say, I'm so sorry. I'm so sorry. Let's try to make this right. Let's try to make this right. So this happened to me this past year before I left. Dr. O'Neill was sick. He had a kidney stone. And he's never been out sick in the 18 years that I worked for him. He had never been out sick. Can you believe that? And so he came to me one day and he said, I don't know, Marge, something's wrong with me. I got this wicked back pain. I got to go home. I can't even stand it. He goes, I think it was something with the kids. He was playing baseball with the kids. So I said, okay. So I canceled his afternoon, thinking, well, he's going to go home and rest his back. He'll be back in the morning. He called me in the morning and he said, I'm sick. I can't come in. There's something really wrong with my back. So I said, okay. So I canceled the day. Just cancel the morning. He says, just cancel. I'll be there in the afternoon. I said, no, I'm canceling the day. So I canceled the day. So first of all, when you call people and you say, I'm so sorry, the doctor's unavailable to see you today, let me reschedule you. I would schedule them for a few days out, and apologize. Some people would be okay with it. Other people would say, well, I got to get in there. It's a pre-op. I got surgery. Okay, you book them with a nurse practitioner or physician's assistant. You go out of your way to accommodate because you're canceling their appointment. So this one guy wasn't having it. He comes right down to the office, right to the front window and says, I want to speak to Marge. I'm fed up with this. I had an appointment. I want to be seen. I don't care. Well, the doctor's not here. I don't know who's going to see you because the doctor's not here. So I bring him into the room, and he is livid. He is mad. This is because I had to cancel him twice. Second time he canceled my appointment. I got things I need to discuss with the doctor. And this is unacceptable, blah, 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 blah. I offered him an appointment with another doctor. No, I offered him an appointment with the nurse practitioners and the physician's assistants. No, he's not having it. I said, okay. I said, well, so I sat there, and I said, listen, my friend is really sick. And I'm sorry that he can't see you, but I'm concerned for his welfare, and I would like you to be too. He's been a friend of yours for as long as he's been a friend of mine, and I'm sorry that he can't see you, and I wish that he was here, but I'm sorry. And the guy's like, oh my God, Marge, I never even thought about it like that. You know? And I said, yeah. And I said, if he could be here, he would be here, and he would be taking good care of you. And he will take good care of you when he comes back. But he can't take care of you now. He's taking care of himself. And so, you know, people don't get it a lot of times. They think like doctors are always supposed to be there for them, and they're people too. You know, and they get sick, and they have problems, and they have things that happen just like we do. So just to let you know, not everybody's nice, not everybody's friendly, not everybody smells good, not everybody is, pleasant. A lot of times, and because I can always like feel a vibe on someone, like, you know, like when you're calling a patient in, like I would call them in, like if it was morning time, and say, like, I would see them, and I'd say, I've been there for so long, I knew them all. I'd say, good morning, Sue, how are you? Come on in. And then I'd be like, nope, something's not right. Sue's not feeling well today. So then we had a routine. We weigh you, you know, we measure you, we do all the vitals. And she'd say, I'm not weighing today. Oh, okay, all right, let's go, let's go. Then I'd get her into the room. So what's going on today? You okay? I said, you're not yourself today. No, I'm not myself today. You know, my best friend just died, or, something. And once you get to know them, if you're in that kind of an atmosphere, not only do you know them, but you know their family. They bring their family in, you get to know them. Or sometimes you'll have like a daughter that will bring her elderly father in, and she'll be like, I'm so sorry, my father just wouldn't take a shower today. Okay, that's what I want. I don't care. They got food all over them. They can't see the food. They're old. They can't see it on them, and they smell funny. That's okay. I still give them a hug. I still say, so good to see you. I'm so glad you came in today. It's so nice to see you. It makes them feel good. We're all going to get old. We're all going to be in that position. So make them feel good. Anybody that comes to the office to see you, or if you're working in the hospital, any room you go into, any place you go that you see a person, that's a person. Don't talk about the procedure. Don't talk about what you're going to do. Talk to the person. I find this a lot when even in my own doctor's office, like his medical assistant is awful. She is like miserable. And I never say anything to her. She doesn't speak to you. She'll call me in. She'll say, Margie. I always say, hi, how are you? She don't want to hear about it. She doesn't want to talk to me. So I said to her, when I went for my physical this year, I thought, well, I'm going to try to work on this. So I said, so how are you today? Nothing. I'm going to take your vitals. Okay. So she sits me down in the chair. She takes my blood pressure. I said, so what was my blood pressure? The doctor will discuss it with you. Well, that's weird. I told all my patients their blood pressure. Okay. So then I said, could you measure me? Because I'm shrinking, And she goes, we don't measure here.
She wants to be.
So I said, well, okay. So she put me on a scale. So I saw it. I measured myself. Okay. So I said, I'm going to turn backwards, though. I said, could you just tell me how tall I am? So she goes, the doctor will discuss it with you. So I'm like, this is crazy. So I turned around and I said, oh, I did shrink. I said, did I shrink from last time? She goes, we don't measure here. Like she was having nothing to do with me. Okay. So I tried. So then she says, well, come. So I said, well, so she goes, grab your things. So I grab my stuff. She brings me into a room and she points like this. Not even a nothing, a points to a chair. And I said, oh, you want me to sit in the chair? Because I was trying to get her to kind of say something to me, I'm in scrubs, too. It's not like I'm in, regular clothes. I'm still working. I'm in scrubs. So I thought she might be a little bit, So she goes, yeah. Okay. So I sit in the chair. So I thought, boy, this is a terrible medical assistant. And how do you, this is wrong. This is wrong what she's doing, So then the doctor's awesome. The doctor, hey, how you doing? Oh, So what was my blood pressure? What's this? Oh, yeah, everything's good. Oh, great. And he is wonderful. So then you go out and, she's sitting at a desk. And she's sitting at a desk and there's nothing on her desk. It's, nothing. And so I said, well, bye. Have a good day. Nothing from this girl. The heck? A terrible medical assistant. Do not do that. Do not do that. That is like awful.
I bet you had a smile to the
Oh my
last
God,
of
I was
your
trying so hard to
45
make
years.
this girl communicate with me and she wanted nothing to do with me. That's totally unacceptable. So, and especially like if you're doing like a procedure for someone, like they're nervous. Even coming into the doctor's office, some people are nervous. They're scared. They're thinking there's something really wrong with them. I got this rash. I don't know what this is. I got this rash. So they'll come in and I'll say, oh, come on in. Like if I've met them for the first time, they're being a new patient. I always introduce myself. Hi, I'm Margie. Welcome to the practice. How are you doing? Come on, I'm going to show you what we do here. We're going to take a height and a weight. I'm going to do this. I'm going to check your blood pressure, your pulse. We're going to go over all your medications. Do you know your medications? Oh, yeah, I know my medications. Some people say I take the little pink one. I take the little blue one. No, I need the names. So if they don't have it, you don't make them feel uncomfortable. You just say, oh, well, if you don't know the names, could you just write them down when you get home off your bottle? And just either mail it in to me or give me a call, and we'll make sure that we get it in the record. You don't try to make anyone feel like, what do you mean you don't know your medicines? That's unacceptable. So you want to talk to the person. So they'll come in and you'll be able to see they're nervous. They're very nervous. I know it's your first time in. A lot of times I would just put my hand on their hand and say, you're in good hands with Dr. O'Neill. He's going to take really good care of you. You don't have to worry about a thing. He's a great doctor. So you don't have to worry about it. Whatever it is, he can handle it. And then they'd be like, oh, okay, great. A lot of people will say like, Marge, I got this rash. I don't know what it is. I'm nervous. I'm scared. What could it be? Could it be this? Could it be this? I went online. This is like the biggest thing.
I Googled it.
I went online. Yeah, I Googled it. I went on WebMD. And they bring out like 15 papers. This could be this. It could be this. It could be this. I might be dying, and I'd say, oh my goodness.
I do that.
And everybody does that. Everybody does that. And then they bring out all their papers, and I'd say, it's okay. Thanks for bringing those in. But Dr. O'Neill will know exactly what this is. He's not going to need those papers. But if you want to go over it with him, for sure, he'll look at those with you. And then they come out and they're like so relieved because, he's a person. He's not like stiff or whatever, and you can talk to them. You have to talk to them. You don't talk about their disease. You don't talk about their cancer. You don't talk about their, their rash. Or like somebody you might come in and their eye might be droopy and their side of their face, they might have like a Bell's palsy going on. And they know they look weird because that's why they called the doctor. And they come in and I don't think you're weird. I think you're the same person. And how you doing? It's nice to see you. And oh yeah, I see you got a little droop there. Don't worry, we'll take care of that for you. It's no worries, because they're worried. They're thinking they're having a stroke. They're thinking, oh my God, is this thing ever going to go away? Am I going to always look like this? They're worried. So you don't want them to be worried. You want them to say, I've seen this before. This is nothing. Really, Marge? They'd say, really? Yeah, it's nothing. Don't worry about it. We'll take good care of you. And then people that that are really sick, like that have cancer, and that they have cancer and they come in, or they just lost a loved one and they come in, and you're like, how am I going to handle this? Like, I would go to wakes of my patients' spouses or whatever, because I wanted them to know that I did care about them, that this person was somebody that was in my life, and they did make a difference for me in my life. And I would say that when I went to the, oh, this is so wonderful. I'm so glad that I could come and tell you how much John or Sally made a difference in my life and how special they were to me when they would come into the office. And they would do these things and I would laugh, or they would tell me a joke and I would laugh. I went to one that was horrific. It was a young boy that overdosed with heroin. And he had just come in the office, and he told me he's on the straight and narrow. He's doing so much better. I got a job, Marge. I'm doing so much better. Oh, I was so thrilled for this kid because he had really had a tough road. He had been in every kind of rehab, every center in the world. He went to California, he went to Florida, he went everywhere, trying to help himself. I didn't make it. So I got the Dr. O'Neill came up in the morning and I got the bad news. I was crushed. This kid's 21 years old and he's dead. Oh, I was crushed. I was like, oh. So I thought, what do I do? Do I go to this? I was like, I don't know what to say to these parents. Both of his parents. Well, his father was a patient. His mother wasn't a patient. But I talked to his mother on the phone so many times because she would call and ask me about all different medications. She called me one day and asked me, where can I get heroin for my kid? I need heroin for my kid, Marge. Where do I get heroin? How? Heroin? I don't know where you get heroin. And so I said, I don't know. I don't know how to help you. You'll have to call around or something. So, but I talked to this woman all the time on the phone. She would always call and she would say, he's doing better. I'm trying to help him out. When he comes in, could you mention this, Marge? Could you ask him about this, Marge? Could you do this? Oh, sure. So he would come in and, we'd talk and I'd say, I'm so proud of you. You're trying so hard. We're so proud of you. And the last time he came in, he told me he got this great counselor. It was this guy who was a heroin addict, but he's recovered. And he got him a job. And I'm doing so good. And I'm like, oh, this is fantastic. And then I got the word. So I did go to the service. And I was like shaking in my shoes about this. All the way there, I was praying. What do I say? Don't say the wrong thing. What do you say to parents when their kid, this happened? And so I got there, and I thought there was going to be a line out the door, but thank goodness there wasn't. And I got there, and I knelt at the casket, and I said a prayer, and I said, why'd you do this? Why'd you do this? And I got up, and his father was standing there, and I went over, and I hugged his father, and I said, I am so sorry that I am here in this room with you for this reason. I don't know what else to say to you, but I can't believe that I'm here. And he said, I know, Marge, I know. And then his wife heard him say Marge, and she came flying over to me, gave me this huge hug and said, I can't believe you're here. I've talked to you on the phone so many times. You were so wonderful to me. To me as a medical assistant, are you kidding me? I did something like this to help this lady. It was just part of my job, but to her, it was her life. And I felt so honored and so privileged just to be able to be there. His grandmother came over to me. She was also a patient of mine. Starts introducing me to the whole family like I'm some kind of celebrity. I was like, oh, this is my granddaughter. And I said, oh my goodness. And I gave them all a hug. And I said, I'm so sorry. I'm sorry to have to meet you like this. I'm sorry that I couldn't have met you on better terms at the wedding or something, So as a medical assistant, you can do so many things. I went into a nursing home to visit my patients who were elderly, and they had no children. They had nobody. And I knew they didn't have anybody. So on my way home from work, I'd just pop in. Hi, how you doing? Oh, I'm so glad you're here. And I'd say, oh, I'll bring you a friendly sundae tomorrow when I come. Or what do you want the next time I come? Oh, I would love a Dunkin' Donuts coffee. All right then. So Saturday morning I'd hop over to Dunkin' Donuts, stop by, here's your Dunkin' Donuts coffee, sit for half an hour to visit, and out the door I go. I wasn't being paid for that, but it's part of my being a medical assistant. It's part of the job of caring for people And I loved that part of the job. I loved being able to help someone, not just in the doctor's office, but in other areas too. And the doctors, all the doctors that I worked with, always allowed me to do that. They would allow me to go to someone's house to draw their blood if they couldn't get out. They'd allow me to go to someone's house if they needed an ear lavage and they couldn't get out. They'd allow me to go to someone's house if they knew that their spouse had just passed away and they were lonely. And I had to ask permission because it's part of, that. And I would say, would it be okay if I would go over and visit Joan today because I know, her husband just passed away. Is that okay with you? And he'd say, oh yeah, please go. And it's amazing what 10, 15 minutes, a knock on the door. They know me, I'm someone that they know. They invite me into their home and they're so happy to see me. 15 minutes of, oh my God, Marge, I can't believe you came. Thank you so much for coming. And we'd just talk about the person that passed away. And we'd say things like, oh, I remember when he did this, or I remember when this happened, or I remember when that happened. And then when they would come to the office, after someone dies and you're constantly coming together to the office, it takes a lot to come into that office by yourself. And they're nervous, and and nobody thinks about that. But it takes a lot. The last time I was here, I was with them. And now I'm coming all alone, and I am petrified to walk through this door because I'm by myself. And so the minute I see them, say, hey, let me give you a hug. How you doing? Nice to see you. Make them feel welcome. Make them feel, don't make them feel like because someone died, you don't want to talk to them anymore, because they're sick, because they have cancer. You don't want to touch them or talk to them because that's how they feel. That's how they feel. They feel like, I have cancer. Or a lot of people know they're dying. Like I had this one lady, she came in, she said, well, I went to the lawyers today, I got everything in order, so I'm ready to go. I said, oh. I said, well, that's good, I guess. And she goes, so, anytime now, I'll just die. Well, so I said, well, that isn't quite how it works. But I said, I'm really glad you're here. I said, you're looking great. I said, I don't think you're ready to go. And she said, when I got the diagnosis of cancer, she goes, I just considered that I was going to die. Well, that's not the case anymore. Like when I first started in medicine, if you got cancer, pretty much you did die. But it's not like that now. Now they have all kinds of things, and people don't die when they get cancer. And people live, and they live long lives. And they live quality of life. They don't just live, with the chemotherapy, throwing up, losing their hair, and not really having any kind of life. They live a quality of life now. There's all different kinds of chemos. There's all different kinds of things for them. So to me, it's like, wow. I've seen it where when I worked in oncology, they would come in, we would do chemo in the office, and they would have their families with them. And I'd get to know them very well. And then the next thing you know, they're getting sicker and sicker. Their hair's gone. They're sicker. They're sicker. They're sicker. They're gone. And so you watch that. I was 18. I watched that. They came in vibrant, healthy. Diagnosis of cancer. Okay, well, we're going to do chemo. Chemo, sick, throwing up, sick, diarrhea, dehydrated, back in the hospital, out of the hospital, in the hospital, out of the hospital, back in for chemo, sick, back in for chemo, sick, die. So now it's not like that. Now, even in my career, I saw that. That's pretty awesome, for me to see that I could see that, wow, chemotherapy really works and things really happen, and I'm a part of it. It's really cool. It's really cool.
Margie, I'm just going to interrupt for 1 second. If my freshmen have to go, because I told them they didn't have to.
Okay.
It ran about half an hour. So if you have to leave, you can go. If you want to stay, you can stay. And I'm sure that some of the girls.
I can just say, did you have any questions before you go?
I don't. You're
Okay.
really good, though.
I'm going to ask, I'm just in awe of when you're talking about conflict. You're describing some conflicts and inappropriate, but I think many of us would find it inappropriate, but the self-possession to address it. Did you have any training in conflict management? Is it just who you are, that you're so clear-minded in it?
Well, this is how I feel.
Or-
I felt as though, it wasn't when I was a new medical assistant. It was when I was a medical assistant for some time. But I also worked with many kinds of different personalities doctor-wise, so I kind of knew. And I knew that I didn't care who you were, and I'm still that way today, even no matter where I am, if it's the grocery store.
Well, I'm envying that.
Okay.
Because I'm not sure I would
Because
be
I
quite
think
so clear
everybody-
in how to respond.
Everybody
It's not appropriate.
deserves the same respect. I don't care who you are or what you are. I would deal with the bum on the street with body lice and then the president of Western New England College, and they're treated the same to me. So for me, everybody deserves respect, and everybody deserves, even if it's not, say like you're not in a good mood, okay. You don't have to be in a good mood, but you still have to be a medical assistant. So I would just say, nobody treats me that way. I don't care who you are. You're not going to treat me with disrespect. And I would even say that no matter where I was. Like even if I was like in a restaurant and the waitress was nasty. And I might say, oh, I can see you're having a bad day. You know, I might say something like that. Or I might say like, oh, that's not right. That's not correct. You know, and it's just because I would never do that to someone else, so I don't want them to do it to me. And if they do it to me, then I just let them know that I don't accept it. So it's not accepting. I'm not accepting it. I'm not accepting your bad behavior. I'm not accepting your bad mood. I'm not accepting whatever you throw at me. I'm not accepting it. I'll just throw it back at you. And all I say is, I don't throw it back with the same attitude.
No,
I just throw it back with
extremely
the
polite and
right.
extremely-
I just throw it
that's
back
just
with
sort of an odd because this is my, I'm looking at 49 here, I'm like, but I think that we take, maybe it's women in society, maybe it's, we give more to other people than necessarily we accept for ourselves, which is that the perfect clarity there and balance
Right.
in the situation you described, like, wow.
It's true. As a woman, you do give more.
Got a lot of practice.
Yeah,
Yeah,
as you
but
do.
I mean, just,
Right.
it's really, it's sunk in as
But just say to yourself, I'm not accepting this. And no matter what happens, you just say to yourself, I'm not accepting this. And then eventually it will come out of your mouth. Eventually it will come out of your mouth. If you work in a doctor's office or you work in a hospital and there's this one doctor everybody says, oh, this guy's a real jerk.
Everyone accepts it, and that's the piece.
Right.
It's like,
And so everyone accepts this guy's bad behavior. I'm not accepting that. So therefore, they're not going to do it to me because I'm not going to accept it. And if they do it to me, I say, oh, I don't accept that bad behavior.
other people don't accept it, they probably just leave, they go
Right.
find another job. So
Right.
it's just, I just appreciate
Right.
that.
Well,
like,
I did go to
odd
another
kind
job.
of-
When I worked at Bay
I was
State.
going to interrupt
Okay.
just because the focus really of the class is why someone would stay in, the person that stays in medical
Right.
assisting all their life. And so you must have had many good stories. And so did you ever think about doing anything else? Why did you always just, that was it, that was good enough, that was satisfying?
Oh, it's been so satisfying for me. It's just the quality of my care to someone else, top notch. Sorry to say it, but it's true. I always treated everybody the best I could possibly treat them, and I knew that I was giving my all, and I always thought it was good enough. You know, I never thought I wasn't good enough because I was giving everything I had. And I was giving it as if that was me, my sister, my mother, my father. I was giving it really kindness, love, tenderness. Those are all things. I never wanted to be a nurse. And you want to know why? Because when I was here at the school, they sent me over to Bay State Medical Center to observe. We all had our maroon uniforms on. And we were only allowed to observe. We were not allowed to do anything, just observe. And there were these nurses at the desk, and they were nasty. And even back then, I wasn't accepting of that, but they were nasty. And so I watched the nurses at the desk, and then I watched the nurse counting these pills. And then I saw these ladies in the room with the patient, reading the magazine, giving them a back rub, talking to them, giving them water. And I'd say, what's her title? What's her title? That's who I want to be. I want to be hands-on. I don't want to throw pills in your face. I don't want to just sit at a computer and type in your vitals. I don't want to come in and say, well, we got to roll you over. That's not what I want to do. That's not who I wanted to be. And back then, the nurses, they were all hardcore. They didn't like what, I say to you, if you don't like it, don't do it. Love what you do and do what you love. Because if you don't like it, you're there forever. It's a job. You have to love it. I loved it. I loved hands-on with the people. I loved it. I loved being able to do a kind gesture of just knowing someone's nervous and just putting my hand on them and saying, it's going to be okay. You're in a safe place. It's going to be okay. We're going to take care of you.
Oh, you're fine. My freshman can leave.
Yeah, sorry.
Yep, that's fine.
Sorry.
Thank
It's
you
okay.
for coming for,
Yeah, thanks for coming.
Thank you. Thank you very
Yeah,
much.
you're welcome.
I was always
Good
thinking-
luck.
I was always thinking, yeah, the freshmen never, if they came for a certificate, they never got the joy of seeing all of our speakers.
Right.
You only got the students that came for their associates. So
Uh,
I thought,
oh, yeah.
I think that all of you have
Right.
so much great information for all of
Right.
them, and they miss out unless they come back for their associates.
Right.
So I said, I'm going to start inviting the
Yeah,
freshmen to come
good.
and sit
Yeah.
in. So, do you have any other
Any
questions
questions?
for her?
So you basically stayed as a medical assistant because it was satisfying.
Oh, so much so. I loved
It
it.
was intimate. It was more intimate than like nursing. Because like even at Bay State, like all the nurses do is like give medications and give injections. The medical assistants actually talk with the patient and stuff. And
Right.
You see that.
And if you're in like where you are, you're like in adult medicine. If you stay
Yeah.
there, you're going to see the same people coming in all the time. You're going to get to know them, and to know them is to love them. And to know you're going to get to not only know them, but then they're going to come in and say, "Gee, I want my Uncle Jerry to come and see this doctor. I want my son. My son just turned 18. He needs to have an adult doctor now." You're going to get to meet the son. And then when the son comes in, the wife comes in. And then, you know what I mean? You get to meet everybody. And then you get to be part of their family. Like they'll say like, "Oh, you know, the other day I did this." Or one guy, he was going to some Red Sox game and he was going to throw the ball out or something. And he was, "Oh, my blood pressure's probably going to be so high. Oh, I'm so excited." And, you know, and you're excited for them because they're part of you. They're part of you. You just love what you do. And it makes a difference not only to you, like satisfying to you, know, to how lucky was I to be able to help someone every single day. As simple as a hello, a smile. A smile. How hard is that? See somebody and just say, "Hey, nice to see you today." Or they're coming into the lab for lab work. They're not even seeing the doctor. And they'll be out in the waiting room, "Hey, Marge, hey, Marge, hey, Marge." And I'd be, "Hey, hey, hey, you know, how you doing, how you doing?" And I didn't realize what a big effect I had on people until I was leaving. And then these people were crying. They were sending me cards, beautiful, tender cards,
You just retired.
telling me that I made a difference in their life. You know, it was a job, but it was a job that I loved. And then I remember when I went to see the doctor when I was leaving, and I said, "Well, this is it. Today's the day. This is it. I'm leaving." And he put his hands like this on his head, and he said, I can't handle it. I can't handle it."
Did he retire with you?
No, he's still working. And I did train the girl. I picked the girl who took my job, and I trained her. And she's wonderful. And I knew she would be wonderful, and I'm thrilled that she's there. I'm hoping she'll stay because I've been on Facebook with her a couple times, and she seems a little... So I keep telling her she's awesome, she's wonderful, keep going. You know, when you're new at something, you're learning. So she's new at this. She's not a new medical assistant. She's been a medical assistant, I think, for maybe 5 or 6 years. But she's new to this aspect of the medical assisting. She was like thrown in this area, thrown in this area. She never had the continuity that I had. So she said, you know, every patient that comes in says, "Where's Marge? Where's Marge? Where's Marge?" And I said, eventually that'll lessen, you know, and all you say to them is, "Well, Marge retired and she's loving it. I'm Kelly, and I'm going to be here to help you," right? Because Kelly's awesome, and Kelly's going to do a great job, but they're used to me. So, and I told them all, you know, "I'm leaving. This is Kelly. Kelly's going to do an awesome job for you." I handpicked her. And a lot of people would say, "Oh, well, if you handpicked her, Marge, then she must be good." You know? But they're used to you. And when they get used to you, they like you. And so, but I never realized to the extent until I was leaving. And even the CEO of the company, he gave me a big hug, a big check, and thanked me for being an awesome employee and an asset to their company, which I was totally surprised. So just love it. Love what you do. It's an awesome experience. It's fun. It's exciting. It's an opportunity to help someone every single day. That's phenomenal. Even if it's just like if people call up and they say, oh, I've been trying to get this medication filled and no one will fill it for me. Can you help me? I've called 3 different doctor's offices. No one's willing to help me. I'll help you. What? You're not expecting that. Sure, I'll help you. I'll do whatever I can to help you. Those are my favorite words. I'll do whatever I can to help you. And I meant it, and I did try to help someone. And a lot of times medicine, blocks you. Getting prior authorizations for CAT scans and MRIs, and a lot of times they block you. They don't let you do the best you can do. But you did your part. Now it's up to them. I always say, well, we contacted the insurance company. They're denying. Why don't you give them a call? I had a guy, I'll just tell you this briefly because I know you all want to get out of here, but I had this guy, I didn't know he was a bigwig at Health New England. He came in, he was a patient, and I was trying to get him a CAT scan. And I'm on the phone trying to get prior authorization, and he's standing there, and he's on his phone, And I said, this could take a few minutes if you want to have a seat. He goes, oh, no, I'm fine. So he's listening to me, and I'm on the phone, I'm saying all these things, and I said, And so finally I said to the nurse on the other end of the phone, you go to one person that answers the phone, and they're just reading things off a screen. And then you go to a nurse. And then the nurse, you have to say the right words to the nurse to get your authorization. So finally, she was really giving me a hard time. So I said to her, so Sue, I said, what do I have to say to get this going? What is it what were the magic words? She kind of giggled and she said, Marge, you're saying all the right words. But she said, I don't think I'm going to get this approved for you today. I said, can you give me a hint? Is there one other word? And she started laughing. She said, no, but she said, I'm going to put this to the doctor and you'll hear in 24 hours. Okay, so I did the best I could. So I say to the gentleman, I'm so sorry I couldn't get this approved for you today while you're here because he's a busy man. I knew he was a busy man. I wanted to book it while they're with me because, you book it and I can't make this day. I can't do this. So I said, I can't get this for you today, and I'm so sorry that I can't get it for you today. But I said, I'm working on this. I said, tomorrow I'll have this for you. He said, okay, Marge. He said, well, I appreciate all you've done. He goes, I was listening to you. He says, you really worked hard on this. Thank you very much. So you're welcome. So about a half an hour goes by, and I get a phone call from Health New England approving this guy's CAT scan. I'm like, great. Nobody's ever called me from Health New England. So I was like, great. So I call him up. And when I call, it says, you've reached Health New England, the office of so-and-so. And I'm like, oh, that's how I got the approval for this. So I get him on the phone and everything. I said, you're not going to believe this. But I said, I got a call from Health New England. He goes, yep, I believe it. He says, and I'm approved? I said, yep. And he goes, one of my friends is a doctor in the CAT scan department. He goes, I'm going to have it tonight. I said, okay, I got the approval. You go for it. I'll send it over. So you just don't know who you're talking to. You don't know who you're dealing with either. A lot of times you don't know who you're dealing. And a lot of people will say that, don't you know who I am? Like, no, I don't know who you are. To me, you're just a patient, and I'm going to treat you like I would treat any other patient that would come in here. So a lot of people have that high and mighty attitude, and that's another thing. I just don't accept it. You are just another person just like me. I just don't accept you. So I don't care who you are, but... So thank you for listening.
So much.
Thank you. Any questions? No? Good luck with everything, you guys. Really, I wish you only the best career possible.